Good morning, Biz Talk family. Let me see your mugshot. Who's got their mugs? All right. Two awesome guests today. We can to get started. Let's go.
Hey, good morning, everybody.
Good morning.
All right, it is a great day in the Fusion One Lounge this morning. I am Glenna Hum, and over here somewhere in the square are our other marketing gurus, Sarah and Kelsey. And at Fusion One, we specialize in getting companies more calls and more business. And then we started Biz Talk to highlight those businesses that we love and get some tips for all of you along the way. So before we get started, Sarah, could you let us know where all of our broadcasts are?
Yes, as always, you can find streaming on Facebook, Twitter, and YouTube. We're also, do you want to connect with us on Instagram and LinkedIn? And don't about our podcast, Marketing and a Mic. And again, subscribe for more on our YouTube channel.
So fancy. All right. We are so excited. These are two of my favorite people that we have in the studio today. So don't want to waste another minute. I want to introduce our special guests, Dr. Keith and Dr. Miracle with Quest for Health Chiropractic. How are you today?
Doing good.
Doing awesome. How you guys doing?
Doing fantastic. We're so excited to have you on today, and we're just going to jump right into this and start the questions.
Cool. Sounds good.
All right. Well, why don't you guys tell us a little bit about yourselves and your background and how Quest for Health Chiropractic came to be?
Okay. Me first?
Yeah,
okay. Well, I'm Dr. Miracle. I'm originally from Chicago, born and raised. I graduated high school in 2009 from Walter Payton College Prep. And then I went to undergrad at the University of Arkansas at Pine Bluff. When I got there, I majored in biology. Wasn't sure what I wanted to go into. I just knew I wanted to be able to help people. And I always loved science. And so a recruiter from Life University, which is the chiropractic school that Dr. Keith and I went to, came to our school during a biology club, talked to us some about chiropractic. And I also told him I was an athlete. I played basketball at UAPB as well. And so he was just telling me, chiropractic is amazing for athletes. So come on down, check us out. And so I went to what was called Life Leadership Weekend, which is like an orientation. And that's where I met Dr. Keith, actually. We met and we viewed the campus and met some of the instructors. And I loved my experiences. So that's why I decided to go to school there. Just a little bit about me. My name is Miracle because my mom had 4 miscarriages and 2 stillbirths before she had me. And so the way that ties into chiropractic, as we started going through our courses at school, we started taking classes about adjusting special populations. And we started talking about how chiropractic was good for pregnancy and for carrying babies full term. And that's when things just kind of clicked in my head that, wow, what if my mom would have known about chiropractic? Maybe we would have had a big family like she originally wanted. And so, that's what made it really, really click for me and made me really, really dive headfirst into chiropractic. And so graduated in 2017 and we got married last year in 2019 in September. So it'll be a year next month and decided to open Quest for Health here in Trustville. So that's a little bit about me.
I'm from Birmingham, not originally, but I'm from a place called Barnwell, South Carolina, which I'm sure very few people have ever heard of. And we don't call it Barnwell, we call it Barnwell. So I'm from South Carolina, but I grew up in Trustville. I went to elementary, middle, high school here. And so it's awesome to be back home, to be able to see my old classmates and teachers and tennis moms and band moms. I was in the band in high school. I was drum major, graduated 2000. I went to Florida A&M University, marched in the Marching 100, and graduated in 2013 with a degree in biology. And then went to chiropractic school, which is where I met Dr. Miracle.
And the rest is history.
Right.
Right.
Well, we've got a lot of people tuning in this morning. We have some early birds that we want to say hello to that also want to say hello to you guys. We have Kenesha Diller is saying hey this morning. She says, that's my best friend. Hey, girl. Hey,
That is my business.
We have Levon Cheney. I think you guys remember Levon. She said, I'm so excited to see Dr. Keith and Dr. Miracle. We have Brenda Blanton, who I believe she's in the Pinnacle group. She's joining in today. We have Andy Enterkin saying good morning. We have Cindy Edmonds. I'm sure you know who that is.
The one and only.
Yes.
The one and only. And we already have a question from Chad Bennett. I don't know if you had a chance to meet Chad. He's in the Pinnacle BNI group as well. He says, can people who have had lower back surgery still benefit safely from adjustments? So we're going to jump right in with a question already.
Yeah, let's do it.
And the answer is yes. We definitely take X-rays on those people, because a lot of times people come in and they tell us, oh my gosh, I've had surgery, and then we take X-rays and we find no evidence of any fusions, anything like that. And so we're like, so what exactly did you have done? But absolutely, we just take those X-rays and we make sure that we work around what we can't touch, because when you do have those surgeries, some of those segments, they don't move anymore, or they don't move very much at all. So the segments above and below have to work a little harder, which puts more stress and strain on those areas and also accelerates degeneration. And so absolutely we will work with those folks. We just got to make sure, we take those films to make sure we know exactly what we can touch. Yes, we do.
Perfect.
Yeah.
Good question.
Yeah, that's a good question right out the gate for sure. So your practice is so unique in so many ways. But I want to kind of jump in with the other chiropractic facilities. They're kind of focused more on pain only and treating pain only with their patients. And your approach is more neurological-based chiropractic care. So can you explain a little bit more of what that's about?
Yeah. So simply put, neurologically-based chiropractic care just means that we focus on the nervous system. And the reason that we focus on the nervous system is because it's the master control system of your body. That's how you're able to move. That's how you're able to function. That's how you're able to think with clarity. And so we want to make sure that that network in which the body communicates is free of any interference. And so the nervous system consists of your brain, your spinal cord, and the nerves that come off. And so the way that your brain communicates with the rest of your body is that it sends signals down your spine, which go out through your nerves to every cell, organ, and tissue. Now, through different stresses in life, whether it's something big and physical like a car accident, a slip and fall, whether it's emotional stress, so stress at home, stress at work, stress at school, or even toxins, things that we eat, drink, and the air that we breathe, right, is not always the healthiest and most pure. Well, all of these things can cause those bones that are meant to protect the spinal cord to actually shift out of alignment and put pressure on those nerves. So when there's pressure on the nerves, that literally causes a disruption in the way that the brain is able to communicate with the rest of the body. And oftentimes that leads to things like aches, pains, but most importantly, dysfunction. And so we see where those nerves go, whether it's the heart, the lungs, the stomach, we see dysfunction of where those organs are. So we see digestive issues, a whole lot, asthma, allergies, other things besides headaches, neck pain, and back pain, which we see as well. And so, that's why we focus primarily on the nervous system. You want to add anything to that?
Nah. You covered it.
That was a really great explanation.
So tell us, what is your overall mission with Quest for Health?
So our mission, and you can find it anywhere. You can find it on the website, on our Facebook page. Our mission is simply to educate and empower our communities to be able to take back their health. A lot of times people just aren't knowledgeable about, one, how their body works, or two, what exactly it is they need. They're just not very educated about that. And so a lot of times people have been kind of cornered or boxed into making certain decisions about their health. And then they come to our office and they're like, if only I'd have known, I would have done something completely different, right? And so our mission is to make sure that we get that educational piece to them, make sure that we get our office mission to them, and just, and really encourage them to know that they don't have to live suffering, right? Mm-hmm. And so that's really the mission of our office, is just to educate as many people as we can to be able to make competent health decisions for the family.
And you guys do a great job of educating people, because you have such a different spin on it and such a different outlook on it. You really like to have people look at it as preventative care too. Can you touch on that a little bit?
Yeah.
Of how that happens?
Yeah, absolutely. So as I was saying before, the nervous system is meant to function without any interference, right? And so we encounter stresses on a daily basis, whether it's, like I said, physical or emotional stress. And so in order to keep yourself functioning at the highest level possible, which means no interference, we come and we get you adjusted. So that way we can take the pressure off of that nervous system and allow the brain to communicate with every part of the body the way that it should. So we don't like to wait until, accidents and traumas and things like that happen to come and try to get the spine in alignment. Let's go ahead and take care of things to prevent these things from happening.
And a lot of times, people who don't have any chiropractic issues, like people love to tell, I don't have chiropractic problems. I'm good. I'm healthy. A lot of times when we have those wellness patients, they come in, they're like, oh my gosh, I had so much energy. It was crazy after I got adjusted. Like I couldn't go to sleep till like 2:00 in the morning. Some people come in and they say, last night I slept like a rock. I didn't know I wasn't getting good sleep. We have some people that come in and tell us all kinds of things, but we also have preventative care for different athletes that we take care of to help decrease the chance of injury, to help improve reaction times. So many benefits to chiropractic care outside of, interact, get a check. So that's our whole goal, is to, again, get that message out there, because a lot of people could benefit from neurologically based care that don't think they have any chiropractic issues. And a lot of people that have energy problems, like they have lack of energy, fatigue, a lot of fatigue. And so they find a lot of positive results when they don't have chiropractic issues. So I think that's a lot about preventative care as well.
Okay, perfect.
Yeah, it's amazing how cohesive your body needs, how it has to all work together, and one thing, it just throws it off. But
Absolutely.
Yeah. So when people come to your office, what's the evaluation process like? What's the process? You go through questions, check their body out. What's it all like?
So, everybody starts with paperwork, of course. And yes, the paperwork tells us what's going on and what's been happening in the past, but it also kind of gives us goals that you have. Some people come in and everybody's body is different. Everybody's health needs are different. And so some people come in and they say, I just want to be able to hold my grandchild. Some people come in and they just want to, not have to take so many medications day in, day out. Some people come in and maybe their goal is to get back in the gym, to get back to working out. Maybe their goal is weight loss. And so that paperwork is really important, not just to tell us what's going on, but also to show you, or to show us rather, where exactly you want to be so that we can get you there. We love to be results driven. And so that's number one. Number two, we go into the rooms, evaluation rooms, and we have our NASA certified space age technology, which lets us get an exact assessment of your nervous system, so we know exactly where your problem areas are. And so it'll pop up on the screen after we get done. It'll show us where you have what Dr. Miracle was calling interference, where the bones are placing pressure on the nerves. It shows us exactly where you have mild, moderate, or severe amount of interference. Shows us where you have most of your muscle tension, so that we know exactly what to work on next. So it's not a guessing game. And after that, we may need to take x-rays, especially we talked about surgeries earlier. We will take x-rays on those folks, but if we need to take any imaging or anything like that, we absolutely will. Again, our motto here is to see is to know, and not to see is to guess. And at no point in time will we ever guess with anybody's health in this office. And so that evaluation gives us a big piece of the puzzle, but also those films that we take in the office, those x-rays are super, super important as well, to let us know how to best be able to help.
Fantastic. I love all of your catchy little slogans and saying.
Yeah.
It's great. And so, to use your own words, Dr. Keith, you are not a pop, lock, and drop it type of
What was that? One more time, Kelsey.
Dr. Keith and Dr. Miracle are not pop, lock, and drop it type of chiropractors. So can you touch on those tools and techniques? I know you just mentioned a couple, but can you touch a little bit more in depth on those tools and techniques that you use on your practice members?
Yeah. And so we will use our hands. Y'all, please don't look at the Facebook or YouTube videos. They scare me too. Nothing like that is going on in here, but we absolutely will adjust by hand. And we do a lot of adjusting by hand, but we also have different instruments in the office that we will use to adjust. Oh,
I was prepared.
And so that instrument looks a little like this. This is called an integrator, and we use the integrator as a part of torque release technique. And so with torque release technique, without us putting our hands on you, we can still get you some really awesome results. One thing that I love about torque release technique and this integrator, it has the most science and research back behind it out of almost any other technique in chiropractic, in the chiropractic profession. And so, which there are over 100 different techniques. And so for this to have that much science and research back behind it, it gets really, really awesome results for us having to put our hands on you. So if people have a preference as to how they like to get adjusted, please let us know. We're pretty flexible here. So it's not all, as Kelsey said, pop, lock, and drop. So we can use other things to be able to get the job done, to get your nervous system functioning better.
Well, I can definitely attest to that because I talked to Dr. Keith and I said, I really appreciate what you guys do, but I don't think I'll really ever come to you because I've been to other chiropractors and I get so tense and they would go ahead and try to crack you anyway and hurt you. But he talked me into it. I went and saw him and he used that tool on me. And I can tell you guys that I was relaxed after just a few minutes because they take that fear away. Mm-hmm. And take that tension away that what are they going to do next? So I just really appreciate the way you guys approach helping people. It's so much different than any place I've ever been before.
Absolutely. And I wanted to show some of these pictures. I guess Glenna, while you asked your question or if you don't, but these are some, we just want everybody to see in action. And I think this is you're using the integrator tool. Is that correct?
That is the integrator, yes.
Yes, and we use that integrator on kids as well, so absolutely.
Yeah.
Oh,
look at that! You got the whole family.
Yes, we see lots of families in our office. This family here is actually a family of seven children. So not together, and all of them get adjusted. So we love it.
Wow,
that is amazing.
Oh. We love her. And her baby is actually here now.
Her baby is 4 months old, and we've been seeing baby since baby was 2 weeks old. So.
Oh wow,
that's fantastic!
Mm-hmm.
I had to throw that picture in because she is the cutest pregnant lady I've ever met.
And one of the cutest people. Oh my goodness! Yeah, so those are some of our Quest for Health babies. The baby to the right was seen, or I guess to the right of the screen. We saw her at 2 weeks old, and then the baby to the left, I believe we saw her at 4 days old.
Mm-hmm.
So, oh my goodness. Yes, the babies.
And this is text neck, as you call it.
And for all of you people on these phones, y'all let the technology destroy you, okay? You see how your spine flattens out right there as you're looking down at that cell phone? A lot of times people don't realize where neck pain is coming from, where shoulder tension and shoulder pain is coming from. And that's called text neck syndrome. It places more pressure on your neck and you start to lose the natural curvature of your neck. That's not a good thing. That means you lose stability. So pick the phones up, please.
Golly, when you see it like that, it's like, oh.
You just made me straighten up.
Right, I'm like, shoulders back.
Well, we want to get to a few people that are joining us again. We have Roxy Kelly saying good morning.
Hey,
Top of the morning.
Gail Mason, she says good morning too.
Yeah.
And Cindy was going to ask about babies, and just to let everybody know, you guys are one of the fastest growing pediatric chiropractic. That was a lot to get out. Pediatric chiropractics practices out there, and you really do specialize in pregnant women and children. That's one of your specialties. What are some of the symptoms that you've helped with babies and pregnant women? If you could kind of expand on that. I know it's a lot, but
yeah. Oh my goodness. So babies, we see babies for all types of symptoms such as colic, so fussy babies, latching issues. So sometimes babies have hard times turning their neck. And so when mom tries to get baby to latch to a certain breast, they have a hard time. We see things like recurrent ear infections in kids, frequent colds, ADHD, even autism. And so reason being, during the birthing process, it's a lot of stress, a lot of pressure on a child's neck, on an infant's neck. And it's not only tough on mom throughout that birthing process, but tough on baby as well, with the pulling and the twisting on baby's head to get them out of the canal. And that doesn't even touch on how the birthing process goes, whether it's like a C-section or a vacuum extraction, use of forceps. Yeah. So all of these things can cause stress and tension on an immature infant's neck. And so infant's adjustment will look a lot different than an adult's adjustment for sure. But we take tension off of their nervous system just like we do an adult, so that their body is able to function better. And really, kids get really, really good results, and they express health a lot sooner than we do see in adults, because they haven't been through as much stress and trauma as we have in our lives.
They're like neurological machines, and they respond very quickly to everything that we do. And pregnant moms, if you've been pregnant before, I'm sure you've heard of round ligament pain and different things like that. Back pain. One lady came to us and we had to get her out of her car and walk her in the office. It was really, really bad. And it was amazing to see, because she got off the table and walked out. And she was like, "I'm walking." And I was like, "Yes, now go home." Things like sciatica. And also a lot of people, when they're pregnant, a lot of moms, when they're pregnant, a lot of their pelvis just is being pulled forward by their hip flexors and ligaments and things like that. So it creates less room for the baby to grow, right? And so with our Webster technique, which is something we use in the office, we're able to free up room in the pelvis so that the baby has more room to grow and decreases the chance of breech births. And so we're never treating a breached pregnancy, but we always make as much room as possible with that Webster technique that we do use on our pregnant moms. And it also helps to decrease labor pain and delivery time. So that's also something that our moms are looking for too.
Perfect. I bet that gives you so much joy.
Oh, yeah.
To have someone that can't even walk in to walk themselves out. I mean, man.
And I know it because we never get before and after videos.
No, we never think about it.
The next person is like, "I can't walk." I'm just going to say, "Hold on." I'm going to grab my phone and we're going to record it.
Yeah. I can't tell you how, I have 3 children. I have 3 children, and had I known, this is so valuable to me. I feel like that piece of it, just because being a mother, being pregnant, all those things that I can identify with. I felt all of that: sciatic nerve pain, back pain, balance. And, it's amazing now that I didn't make that connection of how much, chiropractic care could have helped. But,
not just any chiropractic care, probably. Just because they're specialists.
Yes, and like as belly grows and as baby is growing, it throws off their center of gravity, and that's how pressure is placed on different parts of the spine. But Webster technique is amazing, and we're not the only chiropractors that do Webster technique. We specialize in it, but you can also go for people that's not in the Birmingham area and you're pregnant and looking for and you're looking for a chiropractor to help with to be able to help you through your pregnancy. You can go to the ICPA website and look under Webster certification and just type in your area, type in your zip code, and it'll bring up doctors in your area that are certified in Webster. So they'll be able to help you.
That's ICPA.
forkids.com.
Excuse me.
Okay. Awesome. Wow. Well, I know you already mentioned the torque release technique a little bit, but can you kind of go into that a little bit more and explain how it works?
For sure.
Yeah.
So torque model, and so it focuses on where you have any tension on the spinal cord. And so we use the integrator. It fires at 1/10,000th of a second, so really, really fast. It also is able to use torque, which just means spin, because sometimes the bones don't just misalign in a linear fashion. It misaligns at different angles and degrees. And so we're able to use that instrument to put the correct amount of torque on the adjustment, so it takes tension off that specific region of the spine. And again, when we untorque the spine and get things back in its proper alignment, the nervous system is able to function better, and you feel better.
Cool. Okay, thank you. You've used that tool on me before, and it blew my mind because it's actually really gentle. It doesn't seem it's a big metal, scary looking thing. It doesn't seem like it's gonna. It really feels like a thump, And then all that tension is gone. And I never really understood how that works. So thank you for explaining that.
Yeah, a lot of people think we're about to give them a shot. They've been scarred.
Well, now that we let the kids play with it and touch it and hold it, and let them feel it on different areas of their body first, so that they get used to it before we just put it in different areas. And a lot of the kids call it the clicker, the thumper. They think it's so it's cool to see them kind of transition from being afraid and nervous to being excited and hopping up on the table to get adjusted.
Oh,
Yeah.
so it's safe for elderly. It's safe for children.
Oh, yeah.
Our oldest practice member was 88 years old. And so we've seen a few days old all the way up until just about 90. And so
Oh, wow. Okay.
Everybody.
All right, Sarah, let's go back to your question because I think that's important about the spinal degeneration.
Yes. A lot of people, old or young, experience spinal degeneration. So what are some of the, say, phases that they go through with this issue, and what's your approach on how to treat it?
So you have about 3 different phases, depending on who you talk to. You have 3 to 4 different phases of spinal degeneration. And so each one of those phases looks a little bit worse. And things like holding your head down in your phone on computers all day long will definitely speed that process up. But degeneration, our whole goal is to get motion in the spine when people have a lot of degeneration present on film or x-ray. And so the reason that motion is so important is if those bones, going back to when people have those surgeries, if those segments aren't moving, right, it starts to store up a lot of tension. And so once that tension is stored up, a lot of times it leads to faster degeneration the longer it sets. And so with motion in the spine, not only does it bring nutrients to the joint, but it also helps improve the synovial fluid within the joint. And so that's a lot of times what a lot of people's discs, as well as those joints in between those bones in your spine, need. And so absolutely, motion is super, super important in anybody, but especially if people have any sort of degeneration, especially phase 2, phase 3, where it starts to get a little bit worse.
Yeah, and just to piggyback off what Dr. Keith said, and going right back to the nervous system, the whole goal is to keep pressure off of those nerves so that your brain is able to effectively communicate with your organs and your muscles and your cells the way it's supposed to. And so when we have degeneration, it puts pressure or interference on those nerves. And so as we adjust, because that's how we treat that area, as we adjust and increase range of motion and take the pressure off of those nerves, that's where we see the most benefit.
Okay, perfect. Well, one other question from Lavon. I fall into this group too. What are some of the problems you see most in the over 50 group? I'm sure there's a lot.
The over 50 group, a lot of times the over 50 group is just a lot of that degeneration, a lot of wear and tear that they're experiencing issues from. And so mostly it's a lot of degenerative issues. But again, we start to create motion in those joints. And a lot of times when people help us out by exercising and moving, right, it increases the capacity for chiropractic to be even more effective.
Yeah.
So I think that's a lot of what, outside of sciatica and digestive issues.
Oh my God.
It's a long list, I know.
And a lot of times we see this complaint in this group because this group has been within their careers, on their job for a while. So if it's a sedentary job where you're sitting at a computer for long periods of time, that puts pressure on your lower back and on your spine, and that causes that sciatic pain and those digestive issues. Even if you've been standing long periods of time, we have a few people in here that have been working in steel companies and have to walk on, hard surfaces and stand up on hard surfaces all day.
Railroads.
Yeah, that send forces up through their spine and can cause degeneration as well. And so we help keep their spine in alignment and keep their body functioning how it should so that they're able to continue to work their jobs and continue the career that they've been doing for so long.
Perfect.
Yeah. Well, we know that you participate a lot in community events. Maybe some of that have been scaled back just because of COVID, but the purpose is just to really educate people on neurological chiropractic care. Do you have anything coming up that we can share with our viewers?
You're absolutely right. Due to all that is happening right now, we have not been able to get out there. We're usually out there every weekend, and we haven't been able to be out there at all.
And all types of festivals and
but
shows.
But I think that one thing that, we're looking forward to now, if you go to our Facebook page, you've seen us do a lot of health talks. You've seen us do a lot of lunch and learns. We do health talks for different businesses. We'll come in, bring food, tell you about neurologically-based chiropractic care, and we'll offer you discounted rates to come into the office. And so that's something that we do. And also lunch and learns for different schools and different companies and factories and things like that. So we're looking to try to build our schedule out in the next coming months. And so those are some of the things that we're looking forward to doing because we're not able to do events right now. But yeah, that's kind of what we got going on.
Perfect.
So who would be some great referral partners for your practice?
Well, like we were saying earlier, we love working with pregnant moms and children. So we really love working with doulas, midwives, OBs, OBGYNs. That's a really good connection because a lot of times these pregnant moms are having low back pain and sciatica and don't want to take medications throughout their pregnancy. And so those are really good referrals for us to be able to help them throughout that time. Who else, Dr. Keith?
Massage therapists. We love them and they love us. We can refer back and forth.
Orthopedics.
Oh my goodness, orthopedics. We had one lady come in. She was like, I have shoulder pain, and did the exam and things just weren't looking right. Took x-rays. She had a dislocated shoulder.
Oh my gosh.
Dislocated, like the worst dislocation you could have. And she had been walking around for 14 weeks. And so we sending people out, definitely referral partners with orthopedics is something that we're also looking for because people come in here with some stuff. And so people to help everything that they have going on, they need further assistance. And so orthopedics definitely will be really good.
Perfect. And I know you mentioned personal injury attorneys as well.
Oh my goodness, yes. We don't solely focus on personal injury. We're a wellness-based practice, but a lot of those people, we've seen people come in our office that have been through those types of things before, those types of injuries and traumas before, gone to chiropractors before. When they come to our office, it's the first time they've ever received an adjustment. So we would love to be their first introduction to chiropractic care because after an incident like that, they need to know what's going on with their bodies. And again, our whole goal is to educate everybody that comes through our doors. And so absolutely, we absolutely love to serve personal injury cases because they've gone through a lot. And they probably, through all the cases and stuff, it's a lot of emotional stress as well. So it's just a lot. Thank you for that, Glenna.
Yep. I heard that a few times, right?
Well, I want to add too, just for any individual out there, I actually took my sister to see Dr. Miracle and Dr. Keith for her and decided to get an evaluation myself just because I was there. I didn't think I had anything wrong with my spine or, my day-to-day, but I learned through your x-ray that I actually have 3 vertebrae that are touching each other. And I got text neck like no other. So, I mean,
you are not alone, Kelsey.
Yeah, everybody really needs to be evaluated, honestly.
That's exactly right. And we're going to put your info, we're going to run it down on the bottom here. We do have people looking or listening on podcasts. So their phone number is 205-537-1161. You can also find them on Facebook and Instagram at Quest for Health Chiropractic. And their website, questforhealthchiro.com, correct?
That is correct.
Okay, perfect. And I'm going to give one more shout out over here before we put you guys on the hot seat. We have Claire Owens saying good morning.
Yeah.
So we've got a lot of people tuning in, and you guys gave us such great information. I can't believe 30 minutes has gone by.
Be fast.
That
was quick.
So much fun. And we're going to have a little fun with you right now, too. Sarah, what version of the hot seat are we playing today?
Oh, this is going to be a good one. Okay, guys. You're going to close your eyes.
Okay.
That makes it better so you can watch this after. Kelsey's going to give you some questions, and you're going to just point to either that question relates to you or that question is the other person. So we're kind of backwards, so just make sure you got your pointer in the right in the right direction. Yeah. So, yeah. If the question refers to you, go like this. If it refers to your spouse, go like that. So
let's do it.
All right. Okay, I've got the timer too, Kelsey. So
we got to hit the hot seat.
whenever you're ready, and hang on tight, we're gonna do hot.
Woo, let's go.
Let's go. Are y'all ready?
Yes.
Okay. Let's go.
Who has the better singing voice? Who takes longer to get ready? Who's the better cook? Who stays up the latest? Who has better taste in music? Which of you is more likely to go skydiving? It's not Pat, I'm sorry. Who is funnier?
What was the question?
Who's funnier? Who has better dance moves? Who is more adventurous? Who's the most stubborn? Who is the most patient? Who eats the healthiest? Who's the messier one? That was great.
Oh boy, you gotta watch that back.
You guys are funny. Yeah, you're going to want to watch that replay.
That could also be called "How well do you know your spouse?"
That is so awesome. Well, you guys are so much fun. And again, thank you so much for coming on with us. We really appreciate it and enjoyed it so much.
Thank y'all for having us. We appreciate it.
This is amazing.
Amazing.
Professional.
From beginning to end. Thank you guys.
Oh, thank you for all the great information. And we want to thank everybody for joining us this morning. We had such a great time. And don't forget to join us on Tuesdays at 8 o'clock for Marketing Mix. And also every Friday at 8 a.m. Next week, we have Melissa Keck with Keck Drones and 3D Imaging. She's got some really cool stuff. So can't wait for that. And y'all have a great week.
Bye.
Bye.